scapula, which is also called as the shoulder blade. It lies posterolateral to the thoracic cage. It has two surfaces, three borders, three angles, and three processes. If we talk about the surfaces, we have the costal surface and the dorsal surface. Costal surface or subscapular fossa is concave and is marked by three longitudinal ridges. Another thick ridge adjoins the lateral border. If we talk about the dorsal surface, it gives attachment to the crust of spine, which divides the dorsal surface into supraspinous fossa and larger infraspinous fossa. These fossae are connected by sphenoglenoid notch. The costal surface is rod-like and it acts as a lever for serratus anterior in overhead abduction. So these are the two surfaces. If we talk about the three borders, it is the superior border, the medial border, and the lateral border. So the superior border is shortest, medial border is thin, and the lateral border is thick and has at the upper end the infraglenoid tubercle. Now, if we talk about the three angles, one is the superior angle, which is covered by trapezius, inferior angle, which is covered by latissimus dorsi, and the lateral angle, which carries glenoid cavity and has supraglenoid tubercle. Now, if we talk about the three processes, the first is the spinous process. It is a triangular plate. It's a triangular plate and it has two surfaces and three borders. This is the posterior border, which is called as the crest of spine, and it has two lips, the upper lip and the lower lip. Then this next process is the acromion process. You can see this is the medial border and this is the lateral border of the acromion process, and it has two surfaces, superior and inferior surface, and there is a facet for this is the facet which actually makes acromioclavicular joint. Then we have coracoid process. The coracoid process is bent and is finger-like. It is a tavistic type of epiphysis. If we talk about the muscular attachments, first of all on the costal surface arises the subscapularis muscle, which is inserted on the lesser tubercle. Then on the dorsal surface we have the supraspinatus, which is inserted on the upper part of the greater tubercle, infraspinatus, which is inserted on the middle part of the greater tubercle. They originate from here. And then we have deltoid, which is actually originated from the lower lip of the crest of spine, and the trapezius is going to insert on the upper lip of the crest of spine. Same on the acromion process. You can see this is the lateral border from which originate the deltoid and the medial border where trapezius is inserted. After surfaces, I have gone to the processes. If we talk about the coracoid process, so on the lateral part we have the biceps tendon, and on the medial part we have the coracobrachialis. So they originate from the coracoid process. On the superior surface and medial border we have insertion of the pectoralis minor muscle. So pectoralis minor muscle inserts on the superior surface and medial border of the coracoid process. Glenoid cavity. From the supraglenoid tubercle arises the long tendon of the bicep brachii, and from infraglenoid tubercle long tendon of the tricep brachii. From the coracoid process arises the short tendon of the bicep brachii. Then if we go to the borders, firstly superior border. Here arises the inferior belly of omohyoid process arises from the superior border. From superior border arises the inferior belly of omohyoid muscle. Then if we talk about the medial border, so this is actually the dorsal surface. On the medial we will get rhomboid, minor, major and levator scapula. The levator scapula is also inserted. the rhomboid minor is also inserted, and the rhomboid major is also inserted. Then on the lateral border we have teres minor and major. The teres minor and then teres major. The teres minor is actually originated in slips, and between the slips is actually the suprascapular artery. Teres minor is also inserted on the humerus, and teres major is also inserted on the medial lip of the humerus, the intertubercular sulcus. If we go on the costal surface, then we will not find any insertion or origin from on the lateral, but on the medial inserts the serratus anterior digitations, the first digit to the inferior angle, and then we have the two digitations on the medial medial border, and 5 digitations to inferior angle. So this is the serratus anterior digitations 1, 2 and 5, which makes 8. As I told you earlier, the teres minor is actually originated from slips, by two slips, and between that two slips lies the circumflex scapular artery. If we talk about the ligaments, firstly we remember that the glenoid cavity, the margin of the glenoid cavity, gives attachment to the glenoidal labrum, which makes it socket-like, okay, for the shoulder joint. Then we see that here attaches the acromioclavicular capsule for the clavicular joint. Coracoacromial ligament, coracoacromial ligament. Here arises the coracohumeral ligament between the lateral border of the